Hey there, dog lovers. Welcome to the Ep6 Canine podcast. My name is Anna, and I will be your host today. In today's podcast, we are going to talk about cooperative care, what it is, and how can you get started with your dog. So first things first, what is cooperative care? Since it's a relatively new concept, there is still so much that is coming out about it, which is wonderful. But here are some major points behind why cooperative care is so important for so many dogs, if not every dog. So, part of cooperative care allows the dog to be an active participant of their care. It also allows for a way to communicate consent and therefore gives them a choice about what is being done to them. And because we of all of these elements and because we use it training positive reinforcement, it overall really reduces stress and anxiety. And as a very undesirable side effect, it does build lots of trust in the handler because choice is one of the best ways to build trust and confidence in a dog. So now that we know all of these kind of emotional background portions to cooperative care, let's talk about what it actually is. So, I will entertain you with a very human example, but because we are humans, we tend to relate to these examples the best. So, a lot of people do not like going to the dentist. But imagine if you had to go to the dentist and the dentist still may talk to you, but once you are in the chair about to get the procedure going, they would restrain you to your chair, hold you down, or tie you down with straps. They would force your mouth open, do what they need to do, even if you try to say something, even if you try to wiggle or get away. And once they are done, they will let you free, and they may still hand you a little bag with a little toothpaste and toothbrush and floss, and then they send you on your way. That is the experience most of our dogs have, both at the groomer or the vet clinic, or even at home if you're the one doing the grooming things like nail trimming and brushing, etc., with them. That experience by itself not only is really stressful and anxiety provoking, it can actually worsen those behaviors over time. And while we may get lucky, and please understand what I mean by that, and some dogs just kind of shut down and they won't move, they may just tremble in place or freeze, so the procedure is easy to do on them. That does not mean that internally they're not still going through all those big negative emotions. What cooperative care aims to do is to change that visit from the experience I just described to an experience where you would go into the dentist, you choose to sit on the chair, and then they will tell you what's going to happen to you, and they will explain that if you need a break or if you need to communicate or something hurts, just go ahead and lift one of your hands up as a way to signal, hey, I need a quick break. And they will immediately stop what they are doing, therefore giving you a break. Now, there are two things I want you to think about that in that scenario. One of the portions that you want to think about is simply knowing that you can opt out normally makes you not opt out, which is a funny conundrum, right? I know I have the chance to just stop if I really need to, but I also know it needs to be done, and so therefore that gives me the confidence to keep going. Another portion I want you to think about that is it's not only the choice that you're given, but it's also trust in the person who's doing the procedure to you, because they are there to work with you and not to just restrain you and get the job done. The second scenario is what we're aiming to get to with cooperative care. You may have a couple concerns with this, and I want to address those on the front end. One, okay, well, great. Now my dog can say no to nail trims, so then Fido will just say no to nail trims for the rest of their life. And that is not what we are doing. I absolutely understand, and so does everybody else in cooperative care, that certain things need to be done to our dogs for their safety, for their health, and for their well being. However, if we teach them to say, okay, today I don't feel like it, or right now I'm really, really overwhelmed, can we take a break? That will not lead to someone never doing the things. It will just lead to someone who's not actively struggling against what you're trying to do. And that is the important portion of this whole procedure. Another concern I think that people have is how long is it going to take? And I won't lie to you, it may take a long time. If your dog is severely anxious or nervous, even showing aggression, meaning they bite and growl because of that extreme fear at a veterinarian's office or at the groomer, it will take longer than a dog who may be just indifferent about the experience and the handler or the owner is just trying to be proactive by starting cooperative care early on. What I mean by this is we have students who have been in cooperative care for 5, 6 months and they can now cut a nail a day and they can brush their dog pretty much all they want. They can trim their hair and the dog stays steady. And now they're practicing with their actual vet on the dog, also practicing all these consent behaviors at the veterinarian's office. But that was a dog who may have been really nervous about nail trims and just kind of excited or indifferent about the rest. With dogs that may have very severe fear, it's going to take a way longer, and that's okay. So, what are these behaviors that I keep talking about? What is this opting out or opting in? Well, normally we train one of all three behaviors and we use one of those three trained behaviors. Behavior one is normally a laying down flat on the ground on the dog's side. And whenever the dog lifts their head up, it means that we have to immediately pause what we are doing. Even if you have cut 3 nails out of the 4 and you're so close to being done, if the dog lifts their head, we have to honor that and pause. Once the dog puts their head back down on the ground, it means that we can go ahead and proceed. Some days the dog may actually stand up and leave, and that also means that we have to honor that. It's just not a good day. Is it because of pain or is it because of they just have a lower stress tolerance that day? It almost doesn't matter. They have told you that they're not comfortable with that. Another position that we often use is a chin rest. So what that means is we train the dogs to place their chin in your palm or palms, sometimes depending on which position we practice. And the same idea goes. The dog may be able to do this standing, sitting down, or laying down. And whenever the dog lifts their head off of your palm, it means that they need a break. And they can consent to continuing the procedure by placing their head back down. And last but not least, we can also train the dog to place their chin onto a towel. And wherever the towel is, it may be in your lap, for example, and you're doing eye drops, this allows you to have two hands free. And if the dog is comfortable with what they're doing, they will hold their head nice and steady on the towel. But if they need a break, maybe you did one eye with eye drops and they need a break before the second eye, they can simply lift their head up and wait. You can wait until they put their head back down. I will tell you a secret. The secret is, yes, they get a choice, but we are kind of altering the results with a little trick. And those are treats. So, what I mean by that is whenever the dog chooses to keep their head down, they will receive a treat. So, if they're laying on their side, for example, and I lift their paw up and I squeeze it, and they keep their head down, I will reward them for that. If they have their head down and I squeeze their paw, and they lift their head up, I will let go of their paw, but there won't be a treat. So that is an innate way to kind of skew the results in our favor without removing their freedom to choose. Another thing that comes with cooperative care that is very, very important is working with counter conditioning and desensitization. Those are big words, but what they really mean is if your dog is really, really afraid, for example, a nail clipper, we will have to work on changing the emotional response to that clipper from a very fearful or negative one to one that is at least neutral, but maybe even positive. What I also mean by this is you also have to think about the location where the visit takes place. So if your dog is already afraid of your veterinarian's office, you will have to take them maybe even just to the outside of the veterinarian's office for brief periods of time and then go back home. So it is no longer the place where we go, then something bad happens, and then we go home. We're trying to change the meaning of the place to, yeah, nothing happens, we don't even go in, to eventually sometimes we go in and there's only a treat, and sometimes we go in and they actually do stuff with the dog and not to the dog. And that's a very important caveat. Now I will share with you a little secret, and that is if your dog is really, really mortified of the clipper. For example, my dog, if I take out my nail clipper because of a mistake, not my own, but a vet tech's, she will leave the room. She will not run, but she will leave the room, which is a very strong signal that they are not comfortable with the clipper. So if you have a dog like that, what you could also do is change the object that you're using. So for example, I am training my dog with a Dremel or a nail grinder because that is something that they have no negative or positive associations with. So I get to start with a clean slate. If your dog is familiar and hates both the Dremel and the clipper, you could also try to work with a scratch pad or even a nail file. The scratch pad is really, really great because it can become a fun activity, and it also removes you from having to handle the paws. The only downside of the scratch pad is it's never going to trim the dew claws, which is of course also important to trim. So it doesn't save you from the regular nail trimming methods, but it does make it easier because now you're trimming 2 nails instead of 10. Or, of course, if you have dogs with double front dew claws, then we may be talking more than 10. So those are just some quick tips, but I also want to give you some resources because this is a big journey and I know it's a new journey. So if you're looking at cooperative care, Susan Garrett has a course called Pedicure Please. Or if you would like to check out another online course, there is one called Yes Please Cooperative Canine Care by Deborah Jones and Judy Keller on Fancy Dog Sports Academy. And last but not least, there is also a wonderful book written by Pat Miller and Dr. Leslie Sin. But if you would like to do all of these things in person with the guidance of a trainer, we also offer a cooperative class every Saturday from 3:30 p.m. And you could sign up to that on our website at r+k9.com and join our team of wonderful dogs and their owners who are on the same journey as you. We hope to see you there, or of course, on our next podcast. Have a wonderful day and happy training!